www.healthcmi.com, acupuncture continuing education online. Today, a little bit about acupuncture for cardiovascular disorders. We recently covered deep research showing that acupuncture benefits patients with hypertension. We've also recently covered very important research material showing that acupuncture is specifically good for correcting arrhythmias, particularly for patients with atrial fibrillation. So, the reason why this is very important and deserves review is, one, a lot of great research has come out. For example, this most recent one on hypertension was from the University of California, Irvine. It's an excellent institution. It was excellent crossover blinded research in a randomized control study. So the rigor is there to support the conclusions. Equally as important is that cardiovascular health is absolutely critical. Keep in mind that heart disease is one of the leading causes of death in the world. And acupuncture, also herbal medicine, have a specific role to help people. Now, in the cases of hypertension, acupuncture, of course, is not the only avenue by which people can help their blood pressure, but it can be a very important element, and the research is simply there. Now, in the case of arrhythmias, the stakes are very, very high, and I'll tell you why. Because without getting results for arrhythmias, this can lead to things like a stroke or a heart attack, and that's very serious business. The other thing is that even if arrhythmias, things like atrial fibrillation, irregular heartbeat issues, can be controlled with medication, the medications themselves can be quite toxic. Things like amiodarone and a host of beta blockers definitely have side effects. I'm not saying they're good or bad. I'm just saying there's definitely no free lunch with those. So if it's at all possible to help a patient not have to endure chronic use of these drugs and their side effects, it's better to simply fix it. So in the case of the research, you can look at healthcmi.com. Click on news at www.healthcmi.com. Click on news, and you can scan through and see all the research that's out there. We also are introducing a course on the treatment of arrhythmias and hypertension at healthcmi.com for licensed acupuncturists. We have the point prescriptions that basically have been shown to specifically help people through research. So ancient formulas now proven with research. But more importantly, we can help people not only get rid of the condition, but also not rely on medications. And this is mission critical for an important reason. The more medications we build up, each next medication may have a contraindication with another. In other words, we can't just simply say, well, you have this condition, now take medication A. You have this condition, take medication B. When someone gets up to 5 or 10 or 15 different medications, there can be severe toxicity and side effect issues that will cause their own conditions, which is why I encourage people to really seek, especially for atrial fibrillation and acupuncturists. The acupuncture points can be phenomenal and achieve cardioversion, in other words, normalizing the sinus rhythm of the heart. So go to healthcmi.com, take a look at the news articles. I think you'll like what you see. I'm Adam White, licensed acupuncturist. Thank you for listening. www.healthcmi.com.